My name is Dr. Fatou B. Jobe. I am a medical officer. I work with the Edward Francis Small Teaching Hospital. I graduated in 2016 from the University of the Gambia, and I received a scholarship from the Merck Foundation to pursue a postgraduate diploma in diabetes from the University of South Wales in 2019. And I completed my course in 2020. This course has been very important to me personally, as in I've always wanted to be a diabetic specialist and an endocrinologist, to be more specific. Through my medical school days, I've had a keen interest in pursuing further studies in endocrinology and diabetes in general. So when I saw this opportunity to enroll and have a fully funded scholarship offered by the Merck Foundation, I was happy and was something that was really needed. The postgraduate diploma is quite expensive, and as a civil servant will not be able to afford it. So this scholarship is quite important to me personally, as it has given me the opportunity to pursue what I want and also to learn more. All through my clinical work, I've been dealing with patients with diabetes, and with the knowledge that I've had in medical school, that is what I've been using. But upon doing this, my postgraduate degree, I found out that there is more that needs to be known and more that needs to be given back to the community. So patients have benefited from this course in the sense that they've had better care than they used to have, and they had more options in the medications and the treatment care that they needed. And basically we had this notion that it was either type 1 or type 2 diabetes, but doing this course has taught me a lot about the different causes of high blood sugar or diabetes, and tackling some of the underlying diseases that patients might have led us to resolve some of the cases, like losing weight or dealing with other conditions that patients might have. Upon completion of my course, one of the major achievements that I achieved, and which was part of, I could say, the sole reason why I enrolled in that program, was to impact patients' life, to make sure that patients came in with less complications and they had a better glycemic control. And upon completion of my course, going back and running the clinic more effectively, I made sure that patients had more contact hours with myself and other healthcare providers that were working in the clinic. And as well, this had seen that the patients had a better glycemic control. They knew more about their conditions because of the educational sessions that we had, and we had less patients coming in with complications due to their diabetic that they were living with. So one of the success stories that is quite prominent was one of the patients that came into the emergency department with DKA, which is diabetic acidosis. So I remembered what was taught in our model, as one of our models was bent on teaching us what is diabetic acidosis, what features one uses to identify the investigations needed, and the management. So basically, this is one thing that I have implemented in all my cases that came in with the diagnosis of DKA through the years, and so far I would say that 95% of my patients pull through, and they recover and are discharged from home and from the hospital and sent home. And after discharge, during follow-up, when they come back, with the education that we give them, they've been having a tighter glycemic control and have avoided more episodes of these complications. So these are one of the success stories that I've had. I would just love to say thank you so much to the Merck Foundation. They have changed my life and the life of a lot of Gambians that will come in contact with me. This is something that is very handy, and training one person in the Gambia in diabetes, be it acute medicine, respiratory medicine, and all the others that specialties that my colleagues have been trained on, will go a long way in helping the Gambian communities, the population, and also in our health sector, to make sure that we have a healthier Gambia, and a Gambia that patients come in and see you not because they have complications, but because they know they are supposed to come and see you and prevent those complications from happening. So just to say a big thank you to them, and that I appreciate everything they have done, how they've impacted my life, and how they've put me a step closer into achieving my dreams of being an endocrinologist. And also to thank them for the master scholarship that they are currently sponsoring me on, which will also push me further into the world of diabetes. Thank you.